Hello, good morning, all. Can you all hear me? If you can hear me, can you wave your hands? Let me be sure I can be heard. All right, thank you very much and welcome to today's early echo session. My name is Prosper Onyekachukwu. I'm your facilitator for today. And working with me are some of my colleagues. We have my senior colleague here, Dr. Magnus Odidu. We have Miriam Olawale. We have Dr. Naji Azok, among other persons connected remotely from Phase 3. We'll be looking at another interesting topic today. I want to quickly ask that all the facilities on the call, can you kindly turn on your video? We are interested in seeing you, and we also track that that's behind from the back end of the Zoom. So please, we want to encourage you to kindly turn on your video. And then during the time for Q&A, we will encourage you to use the Zoom platform to raise your hands or send it question through the chat box, and it will be responded accordingly. Without wasting much of our time, I just want to before calling on the Federal Ministry of Health for a good way makes opening remark, that I just want to encourage us to reach out to other of our participants and facilities, the IPs, to come on board and join the call. I noticed that at times people join the call 10 minutes later, and then you must have lost out on a lot of things. And also want to encourage us that from what happened last week, I really got to know that ECHO has become a big platform that we are even putting people through. Phase 3 had a meeting last week with ECHO India and provided support to Kenya and some other African countries, telling them what it is that we have done in Nigeria that they need to adapt to also improve what they are doing in other African countries, and even some parts of India where ECHO started, especially how have we been able to get people to be joining on the call without any form of coerce. So our work here is being appreciated, and we cannot but thank all the participants, thank all the implementing partners, APIN, IHVN, CCFN, and CIHP, and others that are doing great job to make sure that we are live here and that we are presenting to you. So thank you very much, and we look forward for more accolade from other parts of the African countries that are joining. At this point, I want to call the Federal Ministry of Health representative in the person of Omalabake Ekundayo, who is the Senior Population Program Officer, to give us an opening remark. Omalabake, please, can you unmute yourself and go on?
Yeah, thank you, Prosper. Good morning. Good morning to you all on the call this morning. You are welcome to another interesting session of Spice Echo. This morning, I would like to welcome our renowned SME in the person of Dr. Yetunde Akane, who is going to be taking us through the solutions, also the proper things to do concerning adolescent HIV treatment, and also for us to be able to achieve adherence in respect to the treatment given out to this particular set of our population. We know how important they are. So I would also like to welcome the CDC representatives on the call. Also welcome the Phase 3 team. You are all welcome to another session this morning, and also to all healthcare workers on the call. You are highly welcome, and to all IPs that are behind the scenes, ensuring that all the healthcare workers are really joining this session every Thursday. I welcome you this morning. So therefore, on behalf of the Federal Ministry of Health, the leadership of NASCAP, Dr. Kudo Ikbazu, and the head of SI, Dr. Debobola Bashorun, I wish every one of us a successful and a fruitful session this morning. Thank you. Over to you, Prosper.
Thank you very much, Labake. Thanks to NASCAP and thanks to all your support. We want to now call CDC representative to give us a good message from CDC, and standing by to do that is Dr. Ene Uzoma, who is a senior program specialist for HIV care and treatment. Dr. Ene, please, can you unmute yourself and go on with your goodwill message?
Thank you, and good morning once again, everyone. I'm really glad to be here today, and I want to appreciate the Federal Ministry of Health and our collaboration with the Federal Ministry of Health on this, and of course, Phase 3 that is a partner in coordinating this activity. And of course, the participants who have made themselves available today, it's another learning opportunity. And on behalf of the management and staff of CDC, I want to welcome you all today. We just recently celebrated the World AIDS Day, looking around equalize to end AIDS. And it really, for Nigeria, was honing in on how we can close our treatment gaps and treatment access towards sustainable epidemic control. And you will agree with me that there will be no sustainable epidemic control if we cannot put and keep our clients, especially the subpopulation of which adolescents are a key part, on treatment, and also ensure that they have optimal treatment outcomes. And that is exactly why we're here today, to learn how they can be on treatment and adhere, and how they can be properly managed. And of course, I know our SME will do an excellent job today. So I just want to say, please stay tuned. Let's pay attention, and I'm sure that we have a lot to learn today, and to go ahead and implement in our various facilities. Thank you all so much for coming over.
Thank you, Dr. Ende. Thank you to also CDC for all your support behind the scene. We appreciate you. Today, we'll be looking at adherence in the context of adolescents' HIV management. And standing by to take us on this presentation is Dr. Yetunde. She is the Assistant Director of Social Work. She's also a clinical psychologist and a behavior change communicator with University of Port Harcourt Teaching Hospital, a well-renowned subject matter expert who has been on this for quite some time, and we are glad to have her talk to us today. Dr. Yetunde, please, you may want to unmute yourself and go on with your presentation.
So good morning, everyone.
Good morning.
And I want to start by thanking Dr. Ozuamaka for helping us to see the need why we need to close the gap among this subpopulation. So that actually helps me to open the presentation. And so it's a continuation of the adherence counseling we had. We had the module 1, and so this is the module 2. And then the module 2 is a bit specific, talking to the adolescents. And like she rightly said, it's just the right direction to go. The strategic direction globally is looking at the need for adolescents to get the quality health services that it's needed, because they've been neglected in the past. But then we've come to realize that our service provision needs to be modified for us to be able to take care of this population. And so that's why we're being specific on the approach, the counseling approach for adolescents, and why we need to focus on adherence for this group of persons. So just, Prosper, I hope you can see my slide, right?
Yeah, we can see, but we can see it clear. Thank you.
Thank you. So just as a form of recall from the module 1, if you remember, we defined what adherence was, and then we also talked about the importance of adherence, and some of the importance we discussed was that it helps to suppress it brings about viral suppression. It improves quality of life of an individual. Then we also discussed the consequences of non-adherence, which were people would not be virally suppressed, and at the same time, the rate of mortality and complications would increase. We talked about the purpose, nature, and approach to adherence counseling. In the purpose, we said the counseling should be able to help the individual understand why he or she needs to be on treatment. The nature talked about what needs to be done. And so we also remember that we talked about the fact that adherence counseling is an ongoing thing. It's before treatment, during treatment, and even after patient has been initiated. We also discussed how to measure adherence and understand the level of various adherence. And so for this presentation now, it is expected that at the end, you should be able to understand why are we giving special consideration in adherence in counseling to adolescents. And then we need to be able to understand barriers that contribute to adherence, understand why it is important to prepare and support adolescents for treatment preparation, and then develop individualized adherence plan, how to develop adherence plan, and as well as describe how adherence intervention strategies for adolescents needs to be put in place before and after starting ART. And so just as a quick reminder, what is adherence? For those who were not on the previous class, what is adherence? We said adherence is the extent to which a client's behavior matches the prescribed healthcare regimen determined through a shared decision-making process between the client and healthcare provider. That's what adherence is. So it involves two parties. And I want to lay certain emphasis at this point. It involves the clients and the service provider. And so the adolescent is also a client, even though in some cases, some adolescents, okay, for teen, we have younger ones, we have some adolescents that have still been accompanied to the facility for treatment, but we need to understand that they need to be part of this decision-making process. And so what does adherence also involve? It involves taking the right drugs at the right dose, at the right frequency, and at the right time. It also means sticking to other treatment schedules, including hospital visits, doctor's appointment, and nutritional advices. It's good we emphasize this. What is adherence? Because you see, when we supervision adherence counselors talking to clients, they are more specific about, they are more concerned about, I hope you are taking your drugs. How do you take your drugs? Okay, so it goes beyond that. You want to know how they take their drugs, what time, is it the right quantity they are taking? And then you want to know whether they meet up with clinic appointments or not, which forms a basis for adherence. So what then, in a simple we are talking about participation and cooperation. But when we talk about compliance, we talk about command and obedience. And so in most cases, maybe what we've been doing is helping our client to comply by commanding them and expecting them to obey. Or we want to shift, there's a paradigm shift from adherence to compliance. And I want to correct in this house, at no point should we interchange compliance and adherence. They are two separate things. Adherence has to do with participating and cooperation, while compliance is you give the instruction and you expect the individual to obey. And so what are the importance of adherence? Just a quick one: low resistance virus. It brings about better health, maintains suppression, and helps to prevent what? Transmission of the virus. So then, a quick one for everybody on the call. Why do we need to consider, why do we have to consider adolescents during counseling for adherence? Why special consideration for this group of persons? Can I just hear one or two persons share their views?
Okay, so can we have participants just raise your hand and let us know why special consideration for adolescents during counseling and adherence? Why do we need that? Can you just raise your hands and I will call you quickly? Anybody? Anybody, or I should just go ahead and you need to raise your hand so that I can enable you. Hello, are we there? Can we have someone respond? The presenter is asking, why is there special consideration for adolescents? Okay, we have CCFN Abia, Federal Medical Center. So can you unmute yourself and go on? CCFN Abia, okay, please go on.
Good morning.
Good morning.
Yeah,
Good morning, everyone.
Yeah.
You're welcome.
Please, why we should have a special consideration among adolescents during counseling? You know, you need to dwell much time with them because of their age, because of their reasoning, because of the way they understand things. Because these adolescents, you will not see that if you don't do much and tell them what they need to know about these drugs they are taking, you see that some of them will be frustrated because some of them doesn't know what they are taking, even though you have informed them that yes, it's HIV. If you do special counseling during adolescent, especially the adolescent age, if you don't take special counseling, tell them what they need to do and what they need to avoid, most of them eventually find themselves having a reason that my end has come. And this leads them to committing what we call suicide. Many of them now, that personal suicide, they will go and take hard drugs that will make them to, let me end this life. So many a times, counseling these people will help you reason with them, tell them what it takes that this is not the end of life. I have somebody that I counsel.
It's okay. I think because of time. I think because of time. Yeah, I think that's okay. It's just to ensure that as service providers, we know that this subpopulation needs special consideration when it comes to HIV care and services. And so I believe that others share the same sentiments with the speaker that just finished. So we thank you very much. And then as a rider to what she has just said, now let us assess ourselves. Do we give this adolescent time to talk with us based on some few understanding that she just raised now? So it's possible we know this, but when it comes to practicalizing it, what time do we have to share with this adolescent? Do we take into consideration these factors? And so those are the things we need to look at today. Some of these reasons why we need to actually have consider them, especially while counseling for adherence, is few. We need to understand that their developmental stage makes them to engage in more risky-taking behaviors. And so it's a crucial time for physical and cognitive maturation, which at times these young ones find it difficult to be able to actually draw the line between what is right and wrong. And then we also realize that they have a desire to fit in with peers and appear normal. You know that once they start treatment, they start taking drugs, and then they are around people who don't take drugs, and they just want to feel like every other person. And so at times they just have to live their life as if nothing is happening around them. Then we also have reasons like they want to demonstrate defiance or need to define their identity, which is a serious matter for young ones. At times you see that they just want to be a bit rebellious. At times they want to do certain things that will make you feel uncomfortable. They want to do certain things that will make you identify them, recognize them. At times when they need recognition, when they need to be identified, when they just need someone to understand that they are existing, they just need to do certain things outside the normal norms. And once they do those things, you realize, they know that you will call them to action, or you would understand that, okay, this person is around, and that recognition is all that they need. But the problem is that they do not understand the consequences, the long-term consequences. They do not see it. They don't believe, they only believe what they can see or they have experienced. They don't understand the long-term or unseen consequences of not adhering to treatments. At times, they are self-centered, they feel invulnerable to the consequences, which is the same thing. And at times of stress, such as illnesses, I tell you that this adolescent may regress to simple ways of problem solving. And that's why, because they are not yet fully developed, their risk assessment skills are poor. And that's just what we need to understand. And that's why we need to have enough time with this adolescent. We're talking about why special consideration for adolescents. We've been able to see that they engage in risky behaviors. One, majorly, if we have to put them, we need to understand that their developmental stage varies as individuals. There are psychosocial changes, including identity formation and development of independent social relationship. They want to move from being dependent to become independent. And then we'll have cognitive changes that could affect what? Concrete thinking to more abstract thinking. So we need to understand this when we want to deal with adolescents. So in the case of counseling adolescents, I've said it before now, we need to talk about adolescent cognitive abilities and skills are different from that of adults. The way you think is not the way they think. And that's why we told you that at times they do not fully appreciate the long-term consequences of not even taking their medications. They see themselves as being doing well, and so they don't see any reason why they should continue on those medications. So, and we also need to understand that at some point, we have concrete thinking for adults, we have abstract thinking. You can differentiate between the two, but for the adolescents, it's a bit difficult. They have emerging values that present serious challenge. The society needs certain things from them. The society looks up to them for certain things. Parenting also needs to look up to certain things. Culturally, there are certain things, but they also have their own values. And so there will be a contradiction. There's a conflict between the value of the adolescents and even the family, the society. And so in between this value conflict or conflict of values, you are now talking about the need why these people need to be on treatment. So they have a lot of things around them that makes it looks as if they seems unreasonable in the way they act. They are often dependent. Remember that most of these adolescents who started treatment early, maybe as a result of vertical transmission, and at some point now we need to transit them to adult clinic, or they need to start being on their own. It becomes a bit difficult for them because they've always lived a life of dependency. They've always been taught on how to take their drugs. And so that's why in initiating treatment for adolescents, we need to prepare them. We need to help them to understand that they need to be responsible for their actions. And so in being responsible for their actions, then you need to build their coping skills. We also need to understand that they are faced with inability to make decisions, fine. And that's where peer pressure comes in. And so we need to check with them and work with each adolescent based on their cognitive level, their developmental stages. We need to be able to assess their ability to assimilate information, to break down information to the best of their ability, because we need to understand that the adolescent is a time for development of self-concept, identity, where they talk about who I am. And then they are trying to find out who they are. And in the course of that, they are now struggling to incorporate a medical condition into their evolving sense of self. And that's why at times they appear to what? Relegate whatever is happening to them. They want to live in denial as if nothing is happening. Failure to recognize the seriousness of illness. And that results to what? Non-adherence. And then adolescents face strong peer pressure and tend to be dependent on peers for lifestyle guidance. Socially, they want to be accepted by their peer group. And so dealing with this disease poses a challenge to socialization. So these are the things we need to understand. What about adherence to care? For adults, it's a great challenge for them to adhere. How much more of adolescents, considering the factors that we've just dealt with? So because they are not disciplined, they do not have structured life and less stable relationship outside of the family, they lack skill to negotiate health services. It is when we think it's necessary for them to be there, they need to be there. But for an adult can tell you why he or she doesn't need to be there, or why he or she needs to pick up the options for care. But for them as adolescents, they might not be able to negotiate such health services. And then their ability, that brings about cognitive thinking, concrete, I talked about concrete and abstract thinking, understanding side effects, treatment options, and even regimen that is required for them. We also know that tracking adolescents is a bit difficult. And that brings about loss in what? Transition. And that's why for now, it's important to establish the protocol of transition from adolescents to the adult clinic, which is very, very important. We also need to understand that in the course of adherence to treatment, younger adolescents may still rely on a caregiver to take their medicine. I talked about dependency before now and the issue it has on the big challenge it has on them. And for the older adolescents, we try to talk about the need for them to be more responsible for taking their treatment. Adolescents often struggle with that. And so we need to understand that as service provider, we need to meet these people at their point of need. And then we also need to understand that there are various barriers that could affect adherence. But like I normally tell people, especially for the adolescents, these adolescents have a lot of issues they are dealing with in their lives. Some have issues of violence. They have relationship issues. They are from homes, broken, dysfunctional homes. And we as health service providers are more focused on the need for them to adhere to treatment, forgetting that these various factors has a lot to do with adherence. And that's why it's important for us to be able to reach out to these adolescents during counseling. And then we want to talk about what are these barriers to adherence, which we need to know. It's the same for both adults and the adolescent population. We know that we have the health system or service provider factors, and that's why we are working on ourselves as service provider. On the health system, we might have little or nothing to do, and that's why organizational heads also need to be part of some of these presentations so that they would also be able to flow in line, because we don't want to treat any, we don't want to deal with situations in isolation of others. We need to take an holistic approach to health service delivery. Then we have the individual or the client factors. We also have sociocultural factors and illness and medication factors. But then, like I said, I want to focus more on health provider factors, which we'll be neglecting to discuss and measure adherence. And that's why last week during Dr. Chika's presentation, I said it, and I'm still going to repeat it, that was an eye-opener for us. A lot of information to help us build the knowledge base of our clients. Basically, there are things patients need to know. We should move from the normal norm of saying take your drugs every day. For people to effect changes, you need to give people benefits. The information should be beneficial. People should see reasons why they need to do certain things, especially for adolescents. The adolescents need to know why they are doing certain things. They believe in seeing results. And so we need to focus on that. So because we neglect to discuss and measure adherence most times, the non-adherence will now find out that patients become non-adherent at a very late stage. And that's when we have to do some other investigations that now shows. So we have direct and indirect ways of measuring adherence. So we need to employ both. We have an ability to create trust or maintain confidentiality. The young one, the adolescent talking with you, should be able to trust you. And trusting you starts by the way you create rapport with an adolescent. Lack of communication skills and language barriers, it must always come down to the level of the adolescents. Negative attitude towards a patient's ability to adhere, not believing they can do it. Like I keep telling you, the person sitting before you is not the problem. The person is not weak, it's the process that is weak. And so we need to understand that. There are various reasons why clients might not adhere to treatment, which also involves the adolescents, family. Some of them are away from home, some forget or too busy. But for the adolescents, we have some specific reasons why they do not want to take drugs, like what we said the other time. At times, they just want to be rebellious. They just want to be deviant. At times, they're just tired. They find it difficult to fit in with that health condition. And so we need to understand the importance of preparing our adolescents and support them in the course of treatment initiation. And I must say it that that process is always weak. It's been a weak process for us in providing services for persons living with HIV, whether as adult or as adolescent. Our adherence preparation for patients is weak. We need to work on it. Like I said here, all adolescents living with HIV should be given time, at least one section, to talk to a counselor, a healthcare worker, or even an adolescent peer educator in private. It could be in the facility, it could be in the home of the adolescent, whichever one, whichever is appropriate for them at that time. We need to learn to discuss potential adherence challenges and make an individual adherence plan. Help people to build their coping skills. Help people to understand that there are various challenges in the course of starting treatment. There are potentials. You are not sure that they will come up, but then a lot of persons have shared this, have shared that. So what do you think would be a problem for you to adhere to treatment? Let us give people an opportunity to talk. Let them ventilate their feelings. It's very, very important for us as service provider. We need to leave assumptions. We want to believe that this child can do it. The parents will help the child to do it. The child is from, oh, you are looking good, you should be able to do this. Allow the child to speak to you. And that's why we talked about making an individual adherence plan. In making an individual adherence plan, there are certain questions. They are leading questions that help the client to think concretely on what needs to be done so that they can achieve adherence. Then we also talk about getting a treatment buddy. Don't assume that because the adolescent lives with the parents, it is okay with the parents. You might choose someone else, might be more comfortable with someone else who will be a treatment buddy. And so we want to learn to do that too. So in developing adherence plan, what do we address? You want to help the client to understand the kind of medicine they are taking. And that's why you need to check with them. They should know what medicine are they taking, what the doses of the medicine, how often are they supposed to take it, when are they supposed to take their medicine. Help them to establish a routine. It's very, very important. We have some adolescents who are not living with their parents, they are living with guidance or someone, other care providers. You don't even know what they do. You know, at times when these adolescents are accompanied by adults to the facility, the adult sits with them. You don't even have time to discuss with these young ones. And so you cannot actually get the true picture of what is happening in their lives. And then you tell the child, make sure you take your drugs by this time, or what do you think? I will say, no, I'll take it. But then you don't even know what is happening back at home. So we want to establish a routine. And that's why we said, ensure that every adolescent who wants to start treatment is given an opportunity to talk privately with a counselor or a care service provider. It shouldn't just be once, but at least. Then where will they store their drugs? For those who are in school, how do they store their drugs? For even those who are at home, because remember, we are trying to build their ability to take responsibility. Because after now, they move away from home. They will no longer be dependent on their families. Some need to go to school. We have a lot of adolescents who are already even in higher institutions now. So how will you remember to take your medicine at the same time every day? How will you know what you have taken when you have taken your doses so that you don't miss any or take them twice? What will you do when you are about to run out of your medicines? What will you do if you miss a dose of your medicines? Who will help you remember to take your medicines every day? In the course of doing this, the adolescents, you are giving the adolescent an opportunity to think deep and get them involved in the course of their treatment plan, which is very, very important. It also shows how serious the business, whatever you are dealing with the adolescent is. It also helps them to understand that you have a lot of interest in them. I know we do not have enough time to do some of these things, but no matter how little time we have to share with this adolescent, we need to make sure that we develop an adherence plan that deals with the what, the when, the where, and the how of what they need to do. And so I have a case study here. I don't know if we'll have time, but then I think people should just go through this and maybe in their own private time think about as a group, because I know most facilities are joining as a group, so you can walk through this. He said B, an 11-year-old girl was planned to be commenced on ART. B's auntie is a primary caregiver and will be responsible for giving B her ARVs every day. B understands that she has HIV and that she needs to take ARVs every day, but her auntie is still worried how she will manage. How will you help B and her auntie prepare for adherence? And so that involves what? Going through the adherence plan we just talked about, some of those questions there. There's nothing cast on stone there. There are some questions that are not even there, but then some experienced counselors would know how to elicit certain information that will also help to prepare the adolescent for adherence. And then now that we've talked about how we need to prepare our adolescents, what are some of the strategies we need to enhance? What are some of the strategies that will enhance adherence in adolescent counseling? Yeah.
Just a reminder about 10 minutes more.
They're already taking part of my time.
So
some of the strategies we need to understand that we need to adopt is that we need to operate an adolescent youth-friendly center service. So that involves both the service provider, the facility, the infrastructures around there. We talk about convenient location. The adolescent clinic should have health materials and team-focused magazines, something that would take them out of the formal setting, that makes them feel at home. And that's why in some adolescent youth-friendly centers, you see they have games. So they look forward to coming to the clinic. They see it as a way of coming to interact with their fellow adolescents. So we talk about wide range services should be included, sexual and reproductive care. Adolescents who come to the facility should be able to talk about other issues other than the HIV, the causes HIV that brought them to the clinic. We talk about clustering appointments for teens who have to see more than one healthcare provider. And so this has to be done within the clinics where the adolescents seek care. Like in some cases, we have caregivers who are also taking drugs or parents who are also taking drugs. We try to merge their clinic the same day, the same time, so that it's more convenient for those caregivers as well as the adolescents who are also taking treatment. When then we talk about medical regimen, should be simple as possible. So what are the strategies? We need to understand for the adolescent youth-friendly centers, like I've said, or the services we're providing, we need to be very warm and inviting. So I said that the physical appearance should create an environment where adolescents will feel comfortable. And I said that before now. You should have games around. Even the paintings on the wall should give a lot of interpretation to the adolescent. Make them feel at home. Let them know that we recognize them. Then we'll talk about privacy. They want to be treated with respect. And they want to know that they can talk to you and whatever they've told you can be kept with you without what? Diverging to their parents. Although we have what we call revelation moments with adolescents and caregivers, because you need to help adolescents to understand that there are certain things they are going through that they on their own, and they cannot take care of those problems alone. And so they need support. And so, but then in sharing those information with their caregivers or their parents, you need to be very, very careful and help the parents to understand the need not to look down on these young ones. So we talk about another good strategy is using a developmental approach to counseling and education. In doing that, you need a lot of time for private counseling because you need to talk about behavioral and problem-solving skills. You improve the patient's understanding by being friendly and providing instructions clearly and concisely. You need to stress the importance of you need to use short words and sentences that make sense to the individual, the adolescent. And that's why you need to take into consideration their developmental stages, their cognitive abilities. Repeat information as much as possible. Check for understanding of the information you have given. Ensure that what you have discussed with the adolescent is within their cognitive abilities. Encourage them to talk to you. Encourage them to ask questions. And then you, as an individual, as a counselor, you should be able to determine whether the adolescent and his or her family expectation has been addressed in the course of counseling. We need to understand that. Remember that some adolescents are dealing with mental health issues. Even their caregivers are dealing with mental health issues. Remember, I told you, some adolescents are from families with family conflicts. So these are issues that you should be able to identify in the course of counseling. Another strategy is to ensure that there's linkage to other services for these people. Then we talk about ensuring linkage to adolescent peer educators or an adolescent support groups like the Operation 000. There's a presentation we had earlier on this year. Every adolescent clinic should have the Operation 000 club. Every adolescent should be encouraged to join the Operation 000 club. It offers a comprehensive HIV treatment literacy package, and adolescents are empowered to be self-help managers. And then what does the OTC do? It empowers participation to take charge of their health. The adolescents are empowered to take charge of their health, take control of their decisions, and receive support from fellow peers and identify with peers who are doing very, very well. So if we know that we have not been linking our adolescents up to these support groups, then there's a need for us to open up those channels. Then we have tools and reminders. We have containers. Help them to identify how they need to be reminded. Then another strategy too is ensuring that there is a proper appointment system in place that will help to remind these adolescents. Like if you look at on the screen now, you have a peer educator, or it could be a counselor or someone who needs to remind the adolescent. And you could see she's receiving a call from that person who is now reminding her, or who has sent an SMS, whichever one that works or whichever one that can work. I know some of us are in places where we have issues with network, but we need to put a system in place to ensure that we help help the adolescents to help the adolescent to ensure adherence. Ensure tracking systems are in place, and then measure adherence. Very importantly, whenever patients come to the clinic, both adults and adolescents, even though we are focusing on adolescents, help them to measure adherence. It could be direct or indirect. The most important is the assessment of an individual adherence to ART by healthcare worker is often inaccurate. And that's what I said at the beginning of this presentation. Let people tell you what happens to them in the course of their taking their drugs. Don't always ask, are you taking your drugs always? There are times, we know that there are times we use close-ended questions because we want specific responses, but always use the open-ended, not close-ended questions, so that clients you can explore, you can get more information from them. We need to learn to support adherence of these adolescents. It's very, very important. Remember, they are in neglected field. And so once we do not support adherence and there is non-adherence, you know what happens? The process of non-adherence, the risk of transmission becomes higher. And you know that these young adolescents, they engage in a lot of risky behaviors. Some of them don't even know that. They don't even know that. So when you have time to talk with them, they feel that since they're already infected, then there is no need protecting themselves. And so these are some of the things we need to focus on when we talk to the adolescents. So we need to give them the necessary support that is needed for them to adhere. So that's why I said there's a question for us all here. For those who are not operating an adolescent clinic, so what is the best time to have your adolescents come to clinic? So we need to start thinking in that direction. If you know that you are not carving out time for these adolescents, you treat them like every adult that come to the clinic, this is the time for us to start thinking in that direction. And so the key points to this presentation is that adherence is the most important determinant of treatment success. We never start treatment without assessing patient or caregiver's readiness. That is always absent in most cases. You just tell patient, once we do and initiate, you need to start taking these drugs. When you take this drug, it will help you. Your HIV virus will go down. And that's not enough. The person you are talking to is not even looking sick. The person you are talking to does not have any health condition currently. Maybe something happened and he or she got tested. And then the person needs to start treatment. And you now start the person on treatment. And you're not telling the person that once you start taking these drugs, remember the drugs are lifelong treatment. It's not something you take and stop. And so these are some of the informations that you need to share with this person to prepare them for treatment. Educate adolescents on basic aspects of HIV, which is still very important for them. Treatment options, outcome, risky behaviors. Yes, we need to talk about that because you still see adolescents who are on treatment coming with teenage pregnancies, unplanned pregnancies. So something is wrong. Come down with STIs, so something is wrong. So it means they are not well informed. Offer support to promote the goal of adherence by helping the adolescent develop an individual plan, adopt strategies that enhance adherence. We've talked about some of those strategies. So if your health facility is not friendly to youth, you need to start thinking in that direction. You need to develop counseling strategies that is focused on adolescents. Healthcare workers should be accessible, approachable, supportive, and kind to our adolescents. They need that. You know them. Some of us have children at home, and you know that when you try to bully them, they become rebellious to you. And so the same thing happens to us in the health system. So when we become more approachable, more accessible, being accessible has to do with your physical presence, not always even the way you talk and other things in the facility. Monitor and counsel for adherence at every visit, even after many months or years. The multidisciplinary approach is always very important, and client-centered approach helps to enhance adherence among adolescents. And we have always encouraged that. I could remember on the same platform, Professor Akamu talked about the importance of why we all need to be at the same page when it comes to adherence. We need to give out the same information at different times, in different ways, depending on the way the client will understand it. It is important to understand both behavioral and emotional reasons for non-adherence in adolescents. And that's why we need to help them to talk to us. Remember, I told you, a lot of adolescents are going through a lot of psychosocial problems. There are a lot of social needs that are unmet among the adolescents. And it is only when they come to you and they gain your trust, they will open up and talk to you. We have a lot of issues. I had the case of an adolescent.
Hello, Dr. Yetunde.
Who stays with the service provider. Sorry, let me just share this. This is the last slide. I have the case of an adolescent who is with a care provider, but then nobody knew that this child is being sexually abused. Nobody knew. It was in the course of her not being adherent. We wanted to know. I needed to talk to her. And she told me that nobody has ever asked her questions. Nobody has ever wanted to know what is happening to her. The only thing is that everybody always asks her, are you taking your drugs? And so she felt that if the drug is the most important thing, and yet I'm suffering, then why do I need to continue if nobody cares about other things that are happening to me? So we need to understand this and help assess their behavioral and emotional reasons. Develop strategies to enhance adherence in adolescents. It is not the adolescent in front of you that is weak. I'm going to say this again. It is the task that is weak. So that is the end of my presentation. But then I have some talking points for adolescent adherence counseling that will help us as service providers to put into practice some of those things we've heard in the course of this presentation. We have strategies. They are talking points. It makes it very easy for us to talk to the adolescent. It has a lot of pictorials and straightforward statements or comments that will help the adolescent understand faster what you are talking about in treatment preparation of this adolescent. So these talking points are normally used during treatment preparation or in the course of adherence counseling for an individual. Thank you very much.
Thank you very much, Dr. Yetunde. This has been a very wonderful presentation. I can sense the passion with which you want to communicate all, but for salvation of time, we can continue. So Thank you very much, Dr. Yetunde. You may want to stop sharing your screen. Today's topic is very key. You know, in pursuit to HIV epidemic control in Nigeria, the role of a counselor and how we deal with our adolescents is very key. They are very sensitive population, and a lot of what we have said points back to why special attention should be given to them. And a lot depends on counselor. We lost patients, people stopped coming to hospital, people even move from one hospital to another and have a double registration, probably because of the attitude of our counselors. So counselors, your role in this job is very key and really need to do something. Thank you very much, Dr. Yetunde. At this point, we want to open up the floor to questions from participants. We expect very key sensitive questions on dealings with these adolescents. Also experiences we have had, you know, with some of the counselors and all. It's unfortunate we don't have the patients with us. Otherwise, they will tell us all that they have experienced from counselors. That would have been a very wonderful feedback, you know. So maybe if there are probably patient or PLHIV, you know, that is here, or maybe you have had one experience, a terrible experience with counselor, please, you may want to just let us know so that other counselors can learn from it. So the floor is open. Can we have you use the Zoom platform to raise your hands, and then we'll call you to talk to us. Anybody with questions? Also, we have Dr. Ene, who is also one of the very key person in this presentation. Dr. Ene, please, if you want to speak or probably add more to this, you do let me, okay, so that we can call you. So let me take Ojo Osage, and then I will come back to Dr. Ene. Ojo Osage, can you please unmute yourself and ask your question? Ojo Osage. Ojo Osage, I have enabled you to unmute yourself. Can you unmute yourself and ask your question? Okay. Ojo Osage seems to is not unmuted. So let's have Dr. Ene. Can you please unmute yourself? I suppose it should be further contribution or insight to today's presentation. Dr. Ene, please, the floor is open for you.
Yes, thank you very much. And first of all, let me say it's always a pleasure listening to Dr. Akoni with that excellent delivery and content. I see some of the participants also appreciating her in the chat box. Really, thank you very much for that. Just to mention a few things, in addition, she has really covered all the bases. She talked about measuring and documenting.
Dr. Ene, we can't hear you.
I'm speaking right now. I don't know if it's just you or others can't hear me.
Yeah, we can hear you now. Go on.
Okay. Oh, I've been speaking for about 1 minute. So I hope others did hear me appreciating Dr. Akoni for that excellent delivery. And I was just making the point that measuring the adherence, just like she rightly said, is something we should do, but she also emphasized that you should be more interested in what is actually happening with the patient. But I just want to add that it's good to document that as well, so that next time you come back, as imperfect as that documentation might be, it's also necessary for follow-up. Also, in case another person is attending to that particular client, that is something that should be in the patient's folder for every visit. And also, today's slides, I want to remind participants to be a good resource for you, even after the presentation, that you can make reference to. And in addition to that, we do have materials working with your IPs at the sites. Even some of the pictorials you see are from those flip charts, job aids, that are looking at adherence among adolescents, and as well as even enhanced adherence counseling. So do well to make sure those are available in your clinics while you work with them. And finally, just to highlight that for the Operation 000 OTV, which many of us know, which is one of the initiatives for adolescents, that you work with your IPs as well to ensure that the full range of services are provided. And it is just beyond, it's beyond just a club meeting. There are so many other aspects to it. And until we put more attention and more effort in delivering those range of services, we may not see the results that we want to see, because this group requires intentionality and effort on our parts. So once again, thank you, Dr. Akoni. Over.
Thank you very much, Dr. Ene. If time permits me, I will just give a little hint of my dealing with my the young man that worked as a security man in my former house, you know, and the role of a counselor in being able to, you know, sense this the challenge and then get the information out. Let me know if I can be able to talk about that. So let's have Ojo Osagi from APIN. Can we have you unmute yourself, please? Ojo Osagi. Hello, Ojo Osagi, can you unmute yourself and ask your question? Okay, let's take more questions. So while we wait for more questions, talking about the
There's
role
a
of—
question in the chat box, Prosper.
Okay, I'm going to read that now. So the young man, the security man I'm talking about, I don't know, he did some sharp activities and then he couldn't urinate. He was probably STI or so. And he didn't know what to say, who to consult. But by the time he started telling me this, that I did not condemn him. I was quick to say, okay, come, tell me what happened. What did you do last week? What and what? And then he saw that I was not condemning him, and then that I was rather trying to help. He was able to open up and tell me what he has done, the experiences. He wasn't able to pee, probably gonorrhea or something. And you know, I told him, don't worry, I'm going to help you, link you up to what you will do and all of that. Now, if there was no proper atmosphere for him to open up, he may go either start doing self-medication or do something silly that will even affect him eventually. So counselors, I'm not a counselor, but just with the little experience I've had while working in HIV and AIDS, I was able to provide that counseling and address such concerns. So please, a lot is involved with counselors. We can make or mar our program if we don't have a good counselor or if we are not doing the right thing as counselors. Thank you very much. So let's look at the question on chat box. So this is from Tidima Omona. It said, when faced with a special need about deaf and dumb adolescents, would it be okay to seek for the services of someone to interpret? Would that breach the confidentiality expected from the counselor? So this is a quick one. Can we have Dr. Ne, would you want to respond to that, or we should call on Dr. Yetunde?
Let me defer to Dr. Yetunde, who is on the ground, and
Okay,
then I can add. Yes.
Okay, Dr. Yetunde, please, can you respond to that question?
Okay, yeah. Can you hear me?
Yeah, we can hear you.
Okay, so the issue of special needs is a recurrent decimal for us in HIV service provision, especially when it comes to the issue of confidentiality. It's not just for adolescents, even the adults. And that's why we've talked about, we've always asked or encouraged that signers, we should have signers in the provision of HIV services. In as much as you can always seek the consent of those persons, most times with those who accompany them or the adult, somebody who has come with them, because in most cases, when they come to the facility, they are being accompanied, whether as adults or adolescents. But if we really need to deliver services at the level of confidentiality that we are encouraging, and then having enough time to discuss with our clients, then we actually need to engage the services of signers in the HIV service provision. So whereby you do not have a signer, you are left with no option than to get an interpreter, but then it's important you seek the consent of the adolescent or the adult before you bring in any other person that would what? Talk to them.
All right, thank you very much. We're almost out of time. I don't know if there are other questions or other feedback. Okay, let me call on
before any other feedbacks. Prosper, you've been calling counselors on this platform. It's not just counselors. It has to do with all health service providers, all those providing HIV services. I know the counselors are trained with basic skills that it's higher to some other persons, but then you need to understand that it starts from somewhere. So even the person who is in charge of opening cards, the medical record person should know what to do from that beginning. Then till when it gets to the last point where the counselor will take over. Remember that an individual who comes to the facility, the first information they get is what sticks into their brain. You find out that when people come back, they do a repeat test for HIV and you ask them, is this the first time you are doing an HIV test? They said, no, I've done it before. And you tell them, okay, maybe in the course of counseling, you now tell them that their results is positive. They said, no, I've done it before. And then you ask, nobody, did they tell you anything? Say they didn't tell me anything. And so it's that way. And so the person, nobody told the person that the person could be in the window period. There's need for them to repeat this test. There's need to avoid risky behavior so that you don't get it. That is one. And so from the pharmacy to the doctor who is seeing the patient, we have our roles and responsibility. And so we need to learn to put those things in place. When we do those things, the counselor has a fewer, you keep talking about counselors. How many persons are trained as counselors in the facilities? How many? Most times, attrition picks them from that original place where they've been trained to provide services in the HIV program. A lot of traditional counselors that were trained when HIV program started, they are not even in the HIV program anymore. And so they just speaking, people just come in and then they are giving the basic orientation and then they start the process. So there's nothing wrong in getting new people, but we need to develop our skills. So it's not just about the counselors, because you keep saying counselors. So that people will shift blames to just the counselors in the facility, but they need to understand that they also need to start playing their role. The doctor who is saying, the physician who is saying, the clerk who is saying, everybody has a role to play in HIV services.
Thank you very much. It's not just about counselors, but counseling. Anybody who has what it takes to counsel and put people in the right sense and explain stuff should also, take responsibility for that. I'm going to call Dr. Ene shortly, but then let's have Dr. Magnus. Okay, Dr. Magnus, just a minute. Dr. Ogunse, please, can I have you say for just a minute? You've been enabled. Can we have you hear you in 1 minute? Dr. Ogunse, are you there?
Yes, thank you very much, sir.
Please, 1 minute.
The lecture has been very elucidating. Please, in the area of counseling, I think it's very pertinent for every stakeholder to know that they are one way or the other a counselor, even though there are counselors that have gone for training, but every participant in the care of HIV, people living with HIV, should be a counselor. So we should all continue to be trained and retrained. It's not just for a segment of people to say that they are counselors. No, we should make sure that everybody partakes in the act of counseling. That used to be operative, in the past, when everybody will be subjected to training for counseling. So I think we should continue this. God bless you.
Thank you very much. Dr. Magnus, can we have you just make a contribution in less than a minute?
Okay, good morning, everyone. And thank you, Dr. Echinde, for the wonderful presentation, and also Dr. Ene for the support so far. We all understand the implications in terms of managing adolescents. We know that when we look at data, they are almost the ones that have the highest level of unsuppressed. And then when you look at transmission, considering that most of our own geographical region transfer is mostly heterosexual, and you know how risky and active this adolescents are. So we really wish to continue to say that for every healthcare worker, just like the last speaker said, anything concerning adolescents, what pediatrics adolescent, it's something that we must look at heads on, and heads on start from everywhere, because once that adolescent, fortunately, probably maybe comes into the facility alone, the approach, the way the man in the record who asks him, what did you come here for, and all that, the way he talks to him is what decides, should I be here? Am I scared? What he said, has he scared me? Should I come back to this facility or not? And also when they approach, and may probably the nurse or whatsoever, the doctor, whatsoever, says, are you not too young? And all those kind of languages, we need to be mindful and careful about all this. That's why when they say counseling and all that, it's everybody. There are special breed, we need to give them special attention, special care. Yeah, because in all honesty, if we can track and handle the adolescents angle very well, then our HIV program may be good to go, because they are for now giving us almost the highest level of all suppression, and you know what comes with all suppressed viral load, means there's increased transmission. I don't wish to take our time. We are almost 9 minutes above time. Let me stop here and give others. Thank you.
Thank you very much to Magnus for that. Let's just have a final one from Dr. Ene, and then call Federal Minister of Health for a closing remark. Dr. Ene, please, over to you.
Thank you so much. I think it's all been said. I want to believe we're all motivated, we've all been encouraged, and we actually fired up to go out there and deliver the required services to adolescents. It's been a very wonderful session. Again, much appreciation to Dr. Yetunde for the delivery today. It's been absolutely fantastic. Thanks to Vice 3 as usual for the excellent coordination, and really extending our gratitude and also extending our appreciation for the Federal Ministry of Health for collaborating with us on this. So once again, I thank everyone for coming today. Bye-bye.
Thank you very much, Dr. Yetunde. I want to call on the Federal Minister of Health standing by to give a closing remark. Omalawake, please, let's have you.
Thank you, Prosper. I would like to appreciate Dr. Yetunde Akani. Ma, thank you very much for this excellent presentation. It's been very impactful, and I also appreciate all our contributors this morning, and pointing to the fact that, you know, above all, we should empathize with this adolescent and also bring ourselves down to their levels. So I believe we've all have a take home to be able to attend to this adolescent and, you know, give them an excellent, you know, service and delivery. So on behalf of the Federal Ministry of Health, the leadership of NASCAP, Dr. Kude Gazu, and also the EDSI, Dr. Adibobola Basharon, once again, I appreciate you all. To all our partners, CCFN, APN, CIHP, EQs, I really appreciate you. And also to Vice 3 team, thank you for the excellent support all the time. And to CDC representatives that are always on the call, thank you very much. And also to the other SMEs like Dr. Chika Onwam, I can see you there. Thank you very much for joining the call this morning. Dr. John Tunde Aremu, thank you for always being on the call. I wish every one of us a wonderful Thursday. See you all next week. Bye for now.
Thank you, Labeke. And from all of us here at Vice 3, my very self, my colleague, Dr. Magnus, Dr. Unaji, and Miriam Olawale, we want to say thank you. And then we look forward to meeting you again next week with yet another interesting one. Bye for now, and do have a great day.